So have we managed to get Dr. Park back online yet? Yes, and do we have any other questions? But
Can I get
sure.
Dr. Wang? Yes, I very interested about the no blame culture.
No blame.
And what you can detect when it happened.
Okay.
Oh yes, it maybe happened not in front of. Yes, and how can you blame that now in our workplace have the no blame culture? How to monitor?
How to monitor
Yes.
the no blame culture?
Yes. What's this? Yes. This is a difficult to monitor. That is, it not happened. Absolutely no. How many number? Yes. How you monitor this?
Well, I think it comes back to outcomes. Maybe Professor Chi, you want to jump in on that, talking about results and outcomes?
Okay, so if I understand correctly, what you're trying to say is, do we actually practice just culture? How do we know that it is being practiced, right? I don't think we monitor the results. I mean, we don't monitor whether it's truly no blame or people are blaming each other. But I think there are surrogate markers. So for example, I told you that when I first started, we get about 6 incident reports, right? And slowly now we get thousands, by the thousands. And we start getting a near miss reports. These in general tell you that people feel comfortable to report. Now, do I mean to say that in a whole establishment, every single department feels comfortable, there is truly no blame? No, that is not the case. Okay, for example, I did say that certain domains, certain places, you will find that is a bit more, blame is faster to come out than real, investigation and just culture. I mean, that still has pockets, you see. But once you reach a certain stage, so for example, I agree that culture change takes time. And sometimes I tell people, sometimes you have to let a generation pass, right? In some domains, you really need to let a generation pass because you just can't get across that hump, you know what I mean? While in other domains, the same generation embraces it. So different places are different. And the ones that are on your side, I think you need to showcase and sell and in fact, in our hospitals, we have this what we call a good catch celebration. So, for example, you reported, oh, I saw this heparin, which is 5,000 per mil, and it's 5 mils, and then right beside it there's this heparin which is 1,000 per mil, and I saw people getting confused, right? So we call it a good catch, okay, and we celebrate this in front of the whole hospital to say, hey, look, somebody reported this, and this is a good catch, right? And sometimes it is also celebrating how people come together. So, for example, we had a report where the nurse pointed out to the doctor, are you sure you want to do this? Because, the dose is not correct or something like that. And the doctor acknowledged it, right? And the doctor was actually the one who reported and said, I want to, give this good catch reward to this nurse who told me that I was going to do something wrong, right? So these are, reflection of when people feel comfortable, that I won't get caught just because, I wouldn't get blamed just because I almost made a mistake, or I did make a mistake, but someone else came to my help and that person should be rewarded. So I think these are surrogates, because otherwise what we need to watch out for is what we call normalization of deviance, right? On the ground when you can't do something. So I gave you an example, before you give medicine, you must check 10 times. It cannot happen. Right? So everybody on the ground has their own way of getting around this. And after a while, that way becomes the normal, right? It's called normalization of deviance. It's actually a deviate from policy, but it becomes normal. Until one day when someone gets killed or gets harmed. And then suddenly it gets brought up. And then everybody says, but you didn't follow policy. Right? Now, what do you do at that point? You scold everybody and you say, all of you didn't follow policy, you should be fined or you should be fired, or I don't know, whatever it is. But instead of doing that, we should say, well, obviously this policy cannot be followed. Let's look at how we can still make it safe and change a policy. I think all these are demonstration of just culture, and that is something which people are looking at.
Thank you. I'm going to go to Dr. Shan. Your thoughts on this?
I think where you're coming from and asking how do you monitor just culture in an organization.
Yes, or how you know that
It's-
this culture is have growth in your
So
organization.
for where I would stand, I would see the rate of near miss reportings, the rate of reporting rates. So for us in Prince Court, we have a incident reporting system. So I'm able to extract data from that. Earlier in my slide, I did say that data is king. So this is how we are able to show that part. So when you see that your healthcare workers are more open to reporting near misses, that is a sign that you are on the right path, very honestly. Another thing you can do is you can also do the AHRQ survey for patient safety. So part of that survey, the way the questions are designed, you will get information from your staff, your entire hospital, on where they stand in terms of a just culture, a safety culture. So, I mean, safety culture and just culture tend to go hand in hand. So that's a good way. Another way is, of course, like what Dr. Ong mentioned, a lot of it is in terms of leading by example and seeing how your team responds to it, and also having regular engagements with them gives you that. But as a single measure to measure just culture, I don't think I've came across any way of doing that rather than just purely looking at the outcomes. It's an outcome measure, basically. So you're looking at that.
Okay, I'm just going to jump in right now because what we're talking about is very interesting as we get more questions coming out online. But just culture, and you're asking about how do you measure that. Now, any measurement needs to be done by the recipient of the care, not only the person who's giving the care, right? If you want to know the outcome, you have to go back to the recipient. Now, I've been a patient for about 24, 25 years, a patient advocate for about 13, right? And the patient looks at things from a different point of view, like Prof. Chi was saying earlier. They have a different mindset on it. And today, with what we see today in the world, with digital, in everything, they always review. You know, you get 5 stars for restaurants, you get 4 stars for your airlines, for hotels, all these things. And we are going into the culture, if we haven't already, of us looking at things and reviewing them whether we know or not. And I give you an example, right? What happens today is, for those of us who want to fly somewhere, you look online and we look at the airlines that we want to, we look at their ratings, then we look at the price of a ticket, we look at the frequency of them losing your luggage, of being on time. These are things that we look at, and then we choose, oh, I'm going to go with this airline or that airline, and you book your ticket, and you expect your service to be of a certain degree, right? Nobody ever asks, who is the pilot of my flight? Who are the flight attendants who are going to attend to me on my flight? Nobody asks this. And this is the culture that we are going into right now, if we already haven't, because when we go there, we have bought a ticket with the airlines, our expectation is we are fine. Because I've done my due diligence based on information from everybody who wants to fly on this airline. Similarly, now we take that and we interpose it with healthcare. So people are going online to see, I'm going to this hospital, I'm going to the government hospital or the private hospital. How is the reviews on this hospital? We haven't got to the stage of reviewing, but patients talk to each other because we are people, you know, and it's important to talk about person-centered care because I think a lot of people in healthcare look at a patient and say, he is a patient, therefore he is sick. When you look at the same patient as a person, then you start to think, this person is an astronaut and he is sick. This person is a lawyer and he is sick. This person is an engineer and he is sick. So when we put the word patient there, we tend to think the person is sick. He has got no other persona than being ill, right? So we are here to help him. And how does he help us? Right? So that is the key thing that we have to start to change the mindset into looking at the patient as a person and review, asking him, hey, how did I do with this just culture. Is this just culture that we are propagating here from our hospital, is it working for you? Do you get transparency when you complain? Do you get a report back when you do complain? Because I have had issues, obviously being a patient advocate in Malaysia, where we have got people and myself who have complained to a hospital about a certain thing and had no response back. I've had no response. That is the real life thing, right? Because they feel that any comment is a criticism. So they are not thinking of getting better, they are thinking of defending themselves first. Right? So if you turn around and tell me to that point and say, that particular hospital practice a just culture, and I say, as a patient or as friends of patients, we don't feel that. So one of the best ways to judge it would be to integrate the patients or the people who you are serving to see whether they are feeling the same way as you want them to feel. Because at the end of the day, you're delivering the healthcare for them. Sorry, Dr. Kopan,
Yeah,
have you got
10 more minutes.
10
for
more
this
minutes, yes.
session. Let's switch to the audience in this room. Is
Sure.
there any question?
anyone here? This lovely lady here has a good
No,
question. Can you, over here? Please tell us where you're from.
Hi, I'm Sophia from Thailand.
Okay.
I'm from this hospital, which is in Narathiwat, a border province to Malaysia. And I'm a young dentist, just graduated 3 years. And the questions for me will be especially to Dr. Ong from Singapore and other speaker, a significant speaker, if you have the answer. So I'm very interested about grouping of patients or the family members with us, and then because I do agree with you, like we have to listen the feedback from the recipient, right? So we never did that actually, like that before, like grouping, or we do like a personally, but never grouping them. So if I may ask about the process of doing the grouping of the patients and the family member to give us a feedback, like do we have to select them like specially, or we openly everyone to join in, or do we have to wait until like the situation or what happened to them pass, or who should be in the participation chat, like the family, the hospital agent that in that situations, or other one, like how should we cope with that, how should we proceed that to make the outcome to feel not blaming, or to make that success, and we can get from that to improving our hospitals.
Thank you, Sophia, right?
Yes.
Yes, thank you. Prof. Ong, that question is to you mainly, and then we'll jump in. So should.
Okay, so thank you very much for that question, Sophia. And I think I also agree with our host, right? That coming from a patient's point of view is really quite different. So my last slide actually ended by saying what matters most to the patient. And you'll be surprised, right? From a doctor's point of view, I want to know the diagnosis. I'm going to offer you the best treatment. I'm going to offer you a heart transplant, I don't know, everything, okay? But the patient might not want that. I have had patients who tell me, doctor, I've lived a long enough life. I don't need all these things. You keep it for someone else who's deserving, right? I just want not to suffer when I die. Okay, so these are very important things that we do need to hear the patient and make no assumptions, right? So listening to the patient is very, very important. But even as doctors, we know how to listen to one patient at a time. And generally we filter, right? We filter the medical things. But what we are trying to do here is to get our patients to actually give their input on the systems, on their experience. And and to Sophia's question, do you choose the people? Well, I really have to tell you, yes. Because you know that the most vocal people who come forward, yes, we will give it a try. But not everybody is there for everybody's improvement. Some people can be very vocal, but it is more from a personal perspective. And that, yes, you need to still entertain them. So for example, I think our host did say, you know, when I bring in a feedback to the hospital, I never ever hear from them again. Okay, so that is not good, right? You do have to do something about that. But you know, just getting direct feedback on one episode does not help you improve your whole institution. So the people in SPAN, we call it SPAN, that's the Patients Advocate Group, are in a sense chosen, right? And it starts very, very small. Yes, you do have to have an internal organization that supports this. And once they are active, they are actually their own council. Right, they are their own chair and all that, and they choose the next person who comes in. Right, so they know how to collaborate with each other as a team to advance improvement. In fact, I noticed that the person who is actually strongly involved in this is Professor Tan Kok Hian, who's going to speak at 3:15, and his director Zan Fu, which is one of the ladies in that picture, is somebody who really advocates for this SPAN. And of course, we get our communications people to come in as well, because they are the ones who are the ones who start with how to talk to patients, how to, you know, communicate with the audience and the community. I hope that sort of addresses this very big area, and I'll hand it to the other speakers as well.
Thank you, Doctor. I hope that helps you. If anyone else has got a question, just put up your hand. This lady over here in the front. Here we go. That's a mic for you. Just tell us who you are.
Hi, good morning. It's a pleasure being here. Wanted to congratulate the speakers today. My name is Mariam. I'm coming from Spain. Probably there is no one coming from so far away. I have a question for Dr. Chutima. Hope I pronounced it right. I really like your project and the orchestration of people, processes, and technology, and also how outcome-oriented it was and the results you got. I was curious about who initiated this initiative, and if it was initiated in the ICU department, then from where did you get the support, if you got any support from other departments in the hospital? Thank you.
Thank you, Maria.
Who supports for the
Who initiated it, and what kind of support did you get?
The initiation is not only mine, also me. We have the intensivist team and the IT and the nurses in the ICU, yes. And the other doctor who have the same question, the same pain point, yes. And with the healthcare, that the projects, that the 2P safety tech, this provided innovator for us. So we have the new viewpoints as to how to design thinking, how to make with the application, how to do that in the engineering that we don't know. The whole time we learn about the healthcare system, yes, yes. And when we mesh, we can serve this, yes.
Okay, I hope that answers your question, Maria. Any other questions? Please put up your hands. Do we have any more questions online as well? Just to add to that, and I hope, Sophia, just going back to your question, about having the patients explain this to another patient, I have found is more important to patients, right? I have been called in by hospitals in Malaysia to engage with other patients who have had an incident reporting, because they sometimes this happens is when healthcare tries to answer the questions, they are talking too technically. They are talking too process and system-wise, right? And they are forgetting the humanity of the question. So someone who has had an adverse event happen to them or to their family, the pain is real. So they ask a question out of pain. And the person on the other side of the door or the table is trying to answer in a very technical point of view. So then the hospital sometimes calls me, they engage me, and they come in, can you please explain this in layman terms to this person? So I go there and I sit down and I'm sitting there, because I'm the patient advocate. They look at me and say, oh, you're on my side. So then I listen to what they're going to say, and then I explain to them healthcare systems, healthcare processes, right? The fear is real of litigation. The fear is real of a blame culture, the doctor who's had this issue or the nurse who's had this issue. The fear on the other side of the table is very real. Sometimes the person who's complaining just wants someone to put a hand on him and say, okay, we understand, we will improve the system, right? We hear you, and in a lot of those cases, you find that they are happy with this. They are happy with this. But when you start to keep people in a very technical language, you're saying, oh, because of this law and because of this process and because of this system, you forget that that person is feeling pain, that person is feeling fear. I've had a very, very bad experience with my first doctor that saw me. But I am here talking about healthcare and patients because of my second doctor, third doctor, fourth doctor, fifth doctor. I don't only keep in mind the first doctor. I know that every other person wants to be like the second doctor, third doctor, fourth doctor. They don't want to be like the first doctor. That was the anomaly in the situation, right? So how many more minutes do we have? Or are we done already? We want to thank you so much.